Hello everybody and welcome to the Thursday edition of Video Clips. I've got some data to share with you. First of all, according to Professor Yitzhak Ben Israel at Tel Aviv University and head of Israel's space agency, it doesn't matter whether a country quarantines or not, COVID-19 follows the exact same pattern. The number of infected people peaks at about the 6th week and then starts rapidly subsiding by the 8th week. The peak and decline are the same in countries with and without closures, and while the increase in cases begins exponentially, it doesn't continue and fades after 8 weeks. He plotted the course of the virus for the United States, UK, Sweden, Italy, Israel, Switzerland, France, Germany, and Spain in a paper, some of which has been translated into English from Hebrew. In the paper he writes, quote, "I have no explanation. There is speculation. Maybe it's climate related. Maybe the virus just has its own cycle." When asked about Italy, he said that the healthcare system is to blame. It has nothing to do with coronavirus. And he also stresses that with more cases, you get more mortality. Italy had more cases, you get more deaths. Germany had fewer cases, you get fewer deaths, all right, than Italy. He goes on to say that continued quarantines and closures are not justified and can be replaced with more moderate practices. The numbers simply do not support quarantine or economic closure, was his quote. When asked about Israel's quarantine, he says, quote, "I think it's mass hysteria. I have no other way to describe it. 4,500 people die each year from the flu in Israel because of complications. Is the country closes down because of that? No, I don't see a reason to do it because of a lower risk epidemic." He's actually saying the same thing that I was quoting from the two doctors yesterday, that this is actually a lower risk, lower mortality rate than seasonal flu. The hysteria and lockdowns were based on a model from the Imperial College of London developed by Neil Ferguson that projected 2.2 million deaths in the United States and 500,000 in the UK. But the model was incorrect, and in fact, Ferguson is well known for wildly overestimating deaths in his models. And I didn't know a lot about Ferguson. I was glad to look into him a little bit, and I looked at the references that this guy used, this Israeli doctor used. According to Professor Michael Thresfeld of Edinburgh, Ferguson presented a model during the foot and mouth outbreak in the UK in 2001, which resulted in the death of over 6 million animals and left rural Britain economically devastated. So apparently Ferguson's done this kind of thing before. He said at the time, quote, "Extensive culling is sadly the only option for controlling the current British epidemic." Well, according to this particular professor, the model was based on incorrect assumptions about how foot and mouth disease was transmitted. In a 2006 review of the entire episode, he said that the model should not have been used, and in 2011, he called it highly flawed. And so I think that we should, that Ferguson's background should be part of this, because apparently he has a history of making wildly inaccurate predictions. According to Ben Israel, millions of people have lost their jobs and businesses based on what he calls Professor Ferguson's tarot cards. Trump relied on the model because his advisors, including Fauci, told him it was reliable. And I'm going to ask the same question I've asked a bunch of times. Why does Fauci still have a job? Please explain to me why somebody who is using a model developed by somebody who has a reputation of being inaccurate is still employed by the federal government and still getting a salary. He's supposed to be the smart one. He's supposed to know so much more than all of us, and he should have known not to trust a model developed by a person who's well known in epidemiology circles for being wrong. And so when I say he's well known, I did some research on Ferguson, and he's not well respected. He's been wrong before, wrong in grotesque ways that have caused economic devastation. I mean, I don't know what this guy's motive is, but why does he still have a job? Why do any of these people have a job? I don't know how they continue to do what they do, and people take them seriously. All right, I want to talk about Sweden. Health Minister of Sweden, a guy by the name of Anders Tegnell, reported the latest results from the Swedish COVID model. Now, this is April 23rd. They did not quarantine. Again, I'll remind you, when I report data, sometimes the data have changed, but the overall ratios, all that stuff don't change, so we don't have to throw the whole concept out. All right, so there was no crisis, no death spike, no national emergency, no shortage of hospital beds. This is the opposite of what we hear from the histrionic news media, which has reported that the health minister was going to lead the country into complete and total disaster. One thing that I'll mention first before I get into the data here, but you remember last week I talked about Sweden's higher number of deaths because they have big nursing homes and it spreads like wildfire in these huge institutions. It's one of the reasons why Sweden's data kind of on the surface without context look worse than Norway's. And I'll caution you, always look at the context for the data. It's almost always reported out of context, and that's why you get all sideways and email me in the middle of the night with capital letters. All right, so the goal of Sweden's model was very different than ours. It was to achieve national herd immunity as soon as possible. Moderate social distancing was recommended but not enforced, and the focus was to protect the elderly, who are always the most vulnerable to the flu. Businesses were advised to limit the size of crowds, and most schools stayed open, as did most of life. It just went on as before. So here's what Tegnell said. He said the curve is very flat, really, since the beginning of April, and that's good news. He added that there was no rise in cases in Stockholm. No children in Sweden developed COVID-19. So others are starting to speak up about this issue too. Dr. Sukaret Bhakti, a German infectious disease expert, says that his country, Germany's approach to COVID-19 is grotesque, absurd, and very dangerous. He also says that the impact on the world economy has been nothing short of horrifying. Tegnell reports that Sweden has done regional testing and found that about a third of the population test positive, but they're not sick. He goes on to say that the virus is mild and causes no symptoms in most cases, and says, we now have studies that show for every confirmed case, there are probably 999 of them out there somewhere that just weren't serious and maybe asymptomatic entirely. And so when I was talking about the doctors yesterday, millions of cases, small number of deaths, small percentage of deaths. Any way you look at this data, it's all starting to come in the same way. Sweden's handled a lot of other things differently too, and I thought this was perhaps the most interesting thing. Tegnell says positive RNA PCR tests are not considered cases, and the country is working hard to develop accurate death counts, since so many of those who died were elderly people with comorbidities. He refers to these people as ostensible COVID-19 cases until further analysis can be done. And he says that this really means that you can't really tell what the death rate is in Europe, or the percentages, because the testing and the death certificates are not always accurate. And that's quite different than here in the United States, where we're using the RNA PCR test. We're claiming that anybody who tests positive actually has COVID-19 or had COVID-19, and he's basically saying Sweden doesn't see it that way. They feel that more analysis is needed. Tegnell was very insistent about the fact that Sweden doesn't diagnose COVID cases or deaths with, quote, the promiscuity, laxity, non-specificity seen in other parts of the world. I will say that again. They do not test and diagnose with the promiscuity, laxity, non-specificity seen in other parts of the world. Asked again and again about the overall flattening of the trend of flattening the curve, he said yes, and added that he was against what he referred to as the new global religion of COVID panic driven by mass media's unexamined assertions. Amen. And then I have been pleased to see that Dr. David Katz, who I always refer to as the grown-up in the room, is appearing on more and more news programs, one of which is the Bill Maher Show. And I'll share some of what he said, because I think it's really important, piggybacks off of what the guy from Sweden said. He said, and by the way, I found his comments really interesting, because he took some time and ended up spending time in a hospital in the Bronx, actually taking care of patients in a trauma ward. And so his report was interesting. He says, with the models used to justify the current policies having been largely discredited, he says he's working with world-class modelers who are using much more accurate data. And he says if all you do is flatten the curve, you don't reduce deaths, you just change the dates of those deaths. And he says the problem with this approach is it keeps people away from one another, which keeps them from developing immunity. We need herd immunity. And he said preventing viral transmission is not helpful in the long term, because the minute you let everybody out in the world, they're vulnerable. He didn't go so far as the doctors I talked about yesterday, saying that they're more vulnerable than they would have been, but there seems to be universal agreement among thinking people that locking people down makes things worse and not better. He says in Sweden, most of life has remained normal and the numbers are not that different. He quotes them as being a little higher, but he didn't add the context about the size of the nursing homes, which I mentioned when I was talking about the Swedish data. You really have to be careful to take everything in context. These numbers have no meaning by themselves. And they're counting, when the numbers are reported without context, they're counting on people not knowing that. Dr. Katz says that part of the problem we have is that we are talking about polarized extremes. Lock everybody down, well, that's inhumane. Liberate everybody is absurd. And he says in the middle is a middle path that makes more sense. He calls it targeted introduction or something like this, where you actually identify the vulnerable people and you take all of your energy and you protect those people. Elderly people in nursing homes, elderly people who are at home and confined to home and need home care, family members who are living with their younger relatives, for example. He says it's important to remember that you can't get excited every time a young person dies. I mean, young people die every year, and some of them die engaged in everyday activities like walking across the street, but we certainly don't suggest that the response to that is don't let young people walk across the street. I mean, it's just absurd. We know that there's risk associated with living, and we seem to have come to peace with it until we get to this particular issue. As I mentioned, Dr. Katz spent some time working in a Bronx hospital and said that the frontline healthcare workers don't agree with the lockdown either, which I think it's interesting coming from them. It's presented problems for them. One is they're having trouble schooling their kids at home, and if both parents are healthcare workers, somebody has to stay home. And that means that that's one less person who can be involved in helping to take care of the truly vulnerable. The middle path he keeps coming back to is to protect the vulnerable from exposure and get this episode behind us so we can develop herd immunity. And Marr agreed. He said you can't avoid germs or lock yourself away every time something comes around. I mean, germs are everywhere. So Dr. Katz goes on, and this is, again, what responsible people are talking about. He says there's more than one way for this whole thing to hurt and kill people, and all of those ways are bad. But we're destroying the lives and livelihoods of preventing people from working and feeding their families. And the lockdown is causing all these other things that are just completely being ignored. I mean, I've never heard our health director here in Ohio talk about the numbers of people who are committing suicide, overdose deaths, unemployed, homelessness. She never talks about that. The homeless shelters are filled here now, and we're going to have a lot more people when the evictions start happening in June. 30 million people are now unemployed, according to Dr. Katz. I think it might even be higher now. But the problem is it disproportionately and negatively affects the most vulnerable people. In other words, many of the people who are saying we should continue these policies, they're not the people who are affected negatively, and most of their family members probably aren't either. In public health, according to Dr. Katz, we talk about harm reduction, and it can't always be perfect. You know, needle exchange is an example of not perfect harm reduction. We can't get everyone to stop using drugs, so we do the best we can through mitigation, and we're not doing that with this current issue. The goal should be total harm minimization. In order to avoid total destruction, we have to have a more reasonable policy. One thing I thought really curious is that Dr. Katz is not convinced that the testing is very good. He said while he was working at the Bronx hospital, he and his colleagues admitted 20 people at one point that they were sure had COVID, but 19 out of 20 tested negative. The type of testing that really would matter, Dr. Katz says, takes very little time. It's the serology testing in the community. We've had that done in like 4 areas now. It shows the same thing. Millions of cases, not very much death, very small percentage. It just doesn't change the policies at all. Dr. Katz estimates that the death rate in New York is actually 0.5%, very, very low. And he says that he thinks the denominator is even higher than we think right now, which would ratchet that down even lower. So a voice of reason, a person we should be listening to. And I guess the question is, why aren't these types of people being given equal time in our media? This isn't appearing in the New York Times. It's not on NBC News. It's just, it's very unfortunate that the media has chosen to censor, as I said yesterday, anything that's contrary, actively censor, and then deliberately avoid these voices of reason being part of the discussion.